Good morning, Humboldt County. You're listening to 977 The Bolt. It's a very nice Tuesday morning here as we are live from the 977 The Bolt studios for yet another edition of the Your Care Our Mission radio show presented by the Humboldt County Memorial Hospital. My name is Nathan Blackwell. I will host the program, and today, very pleased to be joined by Michelle Bush, as she is with the Therapy Services, and primarily she's going to be talking today about speech therapy, which is a topic that I don't think we've ever discussed on the Your Care Our Mission radio show, so I'm very interested to see what Michelle has for us today. And Michelle, this might be your first time on the radio show, is it not?
It is.
Awesome. So welcome. First time, and she's going to be very excited here today, aren't you?
Yeah.
Absolutely. Okay, Michelle, with speech therapy, what do you have for us today?
Well, we're here to talk about speech therapy services at Humboldt County Memorial Hospital. One of the speech therapy services that we provide is called LSVT Loud. So, what is LSVT Loud?
Right.
LSVT Loud is a speech treatment for people with Parkinson's disease and other neurological conditions. It's named for Mrs. Lee Silverman and was developed in 1987 and has been scientifically studied for over 20 years. LSVT Loud data supports improvements in vocal loudness, intonation, and voice quality for people with Parkinson's disease with improvements that are maintained for up to 2 years. So how does LSVT Loud work? LSVT Loud works by stimulating muscles in the voice box and the speech mechanism through a system of exercises with the focus on a single goal to speak loud. Treatment does not train people for shouting or yelling. Rather, LSVT Loud uses loudness training to bring the voice to an improved, healthy loudness with no strain. Treatment is 16 sessions over a single month. In order to learn a new motor movement, this intensive level of treatment is needed for optimal outcomes. Other people with diagnoses of stroke, MS, Down syndrome, and cerebral palsy may also see positive outcomes from LSVT Loud. So both speech therapists at HCMH, myself, Michelle Bush, and Holly Bruce are both certified in LSVT Loud.
Awesome, and we'll hear from Holly Bruce in the next segment. What else do you have for us here with speech therapy?
The speech therapy department also offers other speech and language services covering all ages from pediatrics to geriatric population. So we see all ages of people who are struggling with communication. So children with language delays, delayed developmental milestones, difficulty pronouncing words correctly, swallowing difficulties, stuttering, and vocal nodules are a few of the disorders that we treat in the pediatric population in the speech therapy department at HCMH. And we also treat adults with a history of stroke, brain injury, head and neck cancer, Parkinson's disease, dementia. Those are just a few of the diagnoses we treat in the adult population.
So in Humboldt County, especially in your department, how many people are you guys treating on a week-to-week, month-to-month basis? I mean, how much volume do you guys have coming through your offices?
We have feast or famine. We seem to be pretty busy these days.
Mm-hmm.
So right now we have about 20 people on our caseload.
Wow. So that's quite a bit. And then, especially with radio, I'm very interested in speech and speech therapy and stuff like that. Do you guys have any tips, I suppose, for better ways of breathing while speaking? I mean, do you guys ever deal with stuff like that?
We sure do. Yeah, we deal with voice disorders all the time, work on breath support, and so people in positions such as yourself don't acquire vocal nodules and things like that.
Well, awesome. It sounds like you guys are pretty busy, and this is the first I ever learned of having a speech therapy place, I guess, in Humboldt. So it's cool to know, and I'm sure you guys are busy, and it's good to see that as well. Now, do you have anything else for us here before we take a break and talk to Holly?
Sure. We wanted to say congratulations to the Unity Point at Home Fort Dodge for being recognized as a top 100 home health agency. Our Humboldt Hospital physical, occupational, and speech therapists are part of the Unity Point at Home team, and they're being recognized for exceptional patient outcomes and superiority quality home care services. So way to go, Unity Point at Home.
Awesome. Well, cool. We'll take a break, come back with Holly Bruce. Stay with us. You're listening to the Your Care Our Mission radio show presented by the Humboldt County Memorial Hospital. Good morning.
Are you looking for a holistic approach to pain management? Hi, my name is Jacob Miller, Humboldt County Memorial Hospital's new certified registered nurse anesthetist specializing in pain management. Don't let pain manage your life. and schedule your pain consultation with me. I offer many types of pain relief, including lumbar, thoracic, cervical, epidural steroid injections, transforaminal epidural injections, medial branch blocks for facet pain, caudal epidural injections, trigger point injections, myofascial injections for various muscle injuries, aches and pains, knee, hip, and shoulder injections, as well as medication management. Pain is unwanted and difficult to tolerate. Call HCMH today and ask to take your first steps in managing your pain at 515-332-7669. Your care, our mission.
Welcome back to the Your Care Mission radio show. Nathan Bleckel with you on a Tuesday morning from the 977 The Bold Studios. We're joined now, after the break, by Holly Bruce, who's also with speech therapy. Wow, maybe I should need to come to you guys after that. But she'll be talking about swallowing, and this is another key part of the speech therapy sessions that you guys do. Let us know what it's all about.
That is right. So we are also able to treat swallowing difficulties. And swallowing difficulties can cause food and drink to enter the lungs instead of the stomach. So this can lead to malnutrition, dehydration, and pneumonia. This can affect both children and adults. And speech therapy can help reduce you or your loved one's risk of lung problems, nutrition problems, and even choking.
Well, that is certainly good to know. Now, when you have swallowing problems, I know someone from back home, I'm from Green Bay, I knew somebody that had to get their throat stretched out. Is that like a common thing to help swallowing problems?
That is something that a gastrointestinal doctor would kind of focus on, but speech therapists can screen for different things that would then lead to a referral to a gastroenterologist.
So you guys are kind of like the first ones at the base then to figure out what these swallowing problems are caused by. And a lot of times, what sort of, I mean, if their throat doesn't even get stretched or something to that matter, what are some of the therapy things that you do to help with that, specifically that problem?
So the muscles in the speech mechanism are the same muscles you use for swallowing. So like any other muscle, if you work with PT or OT, physical therapy or occupational therapy, they need to be worked in order to be rehabilitated. And so if someone has a stroke, they may need exercises to help their swallowing become stronger and to prevent the pneumonia because of food and drink going into the lungs.
Sure, and then last question on this, I wasn't able to ask Michelle this, but where do you have to get your schooling to become where you are with speech therapy? I mean, is there a program directly for speech therapy then?
Yep, there is, and it might be a speech pathology program, or it could be a communication sciences and disorders program. I went to the University of Louisville, and Michelle went to
New Mexico State
University.
Michelle's still in the building, so she hasn't left us. Yes, New Mexico. So we have some transplants here, Louisville, New Mexico State. So pretty cool, awesome. Well, that's cool to know. Obviously, like I said, didn't know about it. It's cool to know that we have something like that here in Humboldt, and it's cool for the people listening. Perhaps someone you know, maybe yourself, is suffering from something like this. The hospital's the place to go now that you know about it. Also, you have for us lots of events, as always, with the hospital coming up, and Holly has them all here for us this morning.
That is right. The HCMH Blood Drive by LifeServe is on Friday, December 1st from noon to 4 p.m. in the HCMH conference room. Make your appointment online at lifeservebloodcenter.org. Walk-ins are also welcome. And tickets are now on sale for the 2018 Founders Event, Light Up the Night for the Health of It, which will be held on Saturday, January 20th. We will offer 2 dueling piano shows again this year. The first show is Seniors and Soldiers at 3 p.m., which will include coffee, desserts, cash bar, and entertainment. The second show is called Light Up the Night for the Health of It, with a 6 p.m. social, appetizers, cash bar, and at 8 p.m. Deuces Wild dueling pianos will take the stage. Only 350 tickets will be sold this year, so go to HumboldtHospital.org to purchase online or stop by the HCMH lobby. Invest in the future of healthcare in Humboldt County. If you are a business owner, there are business sponsorship opportunities as well. Please contact Marty at the hospital. The number is 515-332-4200. That's 515-332-4200.
Awesome. So plenty of events going on. I was at the last year's Founders event. Were you guys there?
No.
No, neither of you. Okay, maybe you should. Are you guys gonna go this year?
Yes.
Planning on it? Okay. Well, awesome. I'll tell you what, it was a grand old night. So look forward to that night as always. Well, appreciate you guys coming in. Holly and Michelle did a great job. First time guests. Give them a round of applause if you're listening at home. They were awesome and very insightful as usual. And next week, remember, same time, same place, right here on 977 The Bolt, another edition of the York Area Mission Radio Show, presented by the Humboldt County Memorial Hospital. Thanks, guys, for coming in, and enjoy the rest of your week.
Thank you.